The Newsday continues here on One News Now. I'm Riza Diaz. Nurses and other health professionals have been at the have been at the front line rather in the battle against the coronavirus pandemic. But the seemingly unending surge in cases plus the dismal treatment they get have led these medical professionals to feel burnt out, with some already resigning for better opportunities. To tell us more, we have with us on the line, or we have with us via Zoom rather, Filipino Nurses United President, Ma'am Maristela Abenojar. Ma'am Maristela, good afternoon.
Good afternoon, Ms. Risa, and good afternoon to all your viewers.
Ma'am, can you give us a description, an overview on the current situation of nurses across the country again amid the pandemic?
Well, if we put it in a short description, most of our nurses now are overwhelmed, extremely overwhelmed, not only because of the many cases that we have in terms of COVID, but also because they have this increasing workload due to lack in staff among them who are at the front line. So most of them have increased patient load and they work more than 12 hours now.
Ms. Maristela, with this situation that you just gave us, the description, would you say that's the reason why a lot of our nurses are driven to leave their profession?
Yes, we can say that it is contributing to the factor that pushed our nurses to leave their work and even leave the country, because they feel the fear, the fear every day they report to work. Because if you have increased in patient load and if you have longer work hours, that also increases the risk of our nurses to acquire the COVID-19 virus. In fact, in the recent data that the Department of Health released, there are now more than 24,000 health workers infected. And about more than 7,000 of this number are actually nurses. Some of them were not able to survive. No, they died due to the disease itself. And the fear is not only for themselves, but also the fear for their families. Because when they go home, they can bring with them the virus. And this happens most of the time. No? In fact, just recently, we received a report, FNU received a report from our health workers in Bulacan. It's a municipal hospital where almost less than 20 of them acquired the COVID-19. And it turned out that their families, also children and spouses, are already positive with COVID-19.
It's really a tough situation, Ma'am Maristela, for our nurses. But what do you think can the government perhaps do, and other private hospitals, to prevent our nurses from leaving?
Well, first and foremost, they have to ensure the protection of our nurses. If you remember, Ms. Risa, last year, our nurses and other health workers have been demanding for more personal protective equipment. And that's still the same thing right now. Most of them do not have adequate PPE to protect them. Likewise, they do also have this feeling that if the nursing shortage in the health facilities where they are working right now will not be addressed immediately, then we can see now our care providers to become more and more patients themselves. For example, in one ICU, intensive care unit, the standard patient ratio should be 1 nurse is to 1 patient. But we heard many stories, even in NCR COVID referral hospitals, where 1 nurse in an ICU is already handling 10 patients or more. Okay, and in COVID ward, the standard ratio should be at least 1 nurse is to 3 patients, and recently we have been hearing of nurses taking care of 15 or more COVID patients in 1 ward. Some of them are severe, some of them are moderate. So it's really too much a workload for our nurses. We are human beings, and even machines, for instance, also give up, diba? Pag they are used most often, no? And we see here now that nurses and health workers who are extremely exhausted with their complete PPEs on them and handling more and more patients. I think what the government need to do right now is to immediately hire additional nurses. This is what we call mass hiring of nurses. And that's the demand of the Filipino Nurses United from our government even last year. And when we say mass hiring, we mean security of tenure for the nurses, not like what they are doing right now, the Department of Health, where they engage into emergency hiring, where nurses are only made to sign contracts for 3 months, or if it's extended, it's 6 months. So there is no guarantee for our nurses to have security of tenure and to also receive other benefits simply because, according to the Department of Budget and Management, contractual workers like contract of service or job order nurses have no employee-employer relationship. So we demand mass hiring with plantilla position so that they have security of tenure. And Ms. Risa, we know that there are 14,000 vacant plantilla position in the Department of Health. We also request the Department of Health to immediately fill this up so that we have more and more manpower in our health facilities. And of course, provide them with all the benefits due for them, especially in this time of pandemic.
Mom, you mentioned benefits. Let's talk more on that. The health department announced a few weeks ago the disbursement of around 14 billion pesos in benefits to frontliners. Have nurses received? Would like to check the benefits due to them since the pandemic has started.
Well, honestly, there are still a lot of nurses who have not received this special risk allowance, especially the COVID hazard duty pay, active hazard duty pay, and the meals, accommodation, and transportation allowances due for them, mainly in the local government units and in the private sector. We have just been monitoring our members in different hospitals and those who are able to submit to us a report before the 10-day deadline given by the president. And until now, they have not received yet. We knew, of course, that the president recently approved additional budget, no? But this is still in paper. This has not been trickled down to our health workers. So we will be closely monitoring. And what we appeal to the Department of Health is to come up with a list, show the list in public of the hospitals where they have already provided or downloaded the amount for the benefits so that our health workers in those respective hospital can cross-check or verify to DOH whether or not they have received the benefits.
Ma'am, last question. There is a pending bill in the House of Representatives seeking to provide hazard pay to all healthcare frontliners that's equivalent to at least 30% of their basic salary. Would like to get your opinion on this.
Well, we want that if ever there will be a bill to be passed, it should be really benefiting all the health workers, not only those who are in work in the COVID ward, because many of our health workers are exposed to this by airborne, no? By airborne to this virus. So that's why to be fair, all our health workers, even those outside the COVID ward, should receive the necessary hazard pay or special risk allowance. And secondly, we also want the budget to be really, really according to the needs of our health workers. Unlike what is happening right now, they're always saying we don't have enough budget. They will still source it out from other line items of DOH budget or from savings of the Department of Health or respective health facilities. We want an assurance that there will really be enough budget for our health workers and that they will closely monitor our health facilities. There will be clear guidelines on this so that the interpretation of the benefit is not left on different interpretations of the respective human resources department or finance department of the health facilities. So, like I said, there should be really adequate budget. It should be closely monitored. It should be available to all health workers, and it should not be on what we call this prorated basis. Just like what is happening now, the special risk allowance is prorated. So it's divided, the 5,000 is divided by 22 days. So that's only about 227 pesos a day. So when they are, for example, on quarantine or they are sick of COVID and they are not working, they don't receive the benefit. We want the benefits to be given to them per month. No? So that includes the quarantine period. So that there will be also an assurance that while our health workers and nurses are on recuperating or a quarantine process, there will be enough benefits to be provided to them.
Mama Maricela, I would like to thank you for sharing with us your time and your insights. And of course, we appreciate the service that you give for our country, all along with, of course, the nurses here in the Philippines. Maraming salamat po. That was Filipino Nurses United President, Ma'am Maricela Abenojar. Meanwhile, the Office of the Vice President continued its Vaccine Express in Pasig City to complete the vaccination of over 1,000 residents in the area. This time, Camille Samonte is joining us live from Pasig City to tell us more about this. Camille, good afternoon. We'd like to know how many residents were able to receive their shots today.
Riza, the Office of the Vice President conducted a second run of its Vaccine Express in partnership with Pasig City in Manggahan High School. Over 1,500 residents received their second dose of Sinovac vaccines. The vaccine rollout is a collaboration between the OVP and Pasig City LGU, which aims for a more efficient vaccination among residents. Vice President Leni Robredo personally visited the site to thank the medical volunteers who are working hard to administer the jabs. Robredo said the system and manpower they provided is a big support to the LGU to increase the number of vaccinations per day. The vaccines are sourced from the city or municipality stockpile. Those who will be inoculated will receive a post-vaccine kit, which consists of face masks, vitamins, and bottled water. Meanwhile, Robredo disagrees with the Interior Department's warning that those who will refuse to get tested during contact tracing will pay fines or even imprisonment. The Vice President said that the government should instead incentivize testing instead of instilling fear among the public. Riza Vice President Leni Robredo said their office is also planning to expand the Vaccine Express in different LGUs in the coming weeks. They are targeting to inoculate indigenous people in Tarlac and other marginalized communities. Riza?
Well, thank you for that report and stay safe. That's Camille Samonte reporting live from Pasig City. Now, tributes have started to pour in for the late Social Welfare Secretary Dinky Soliman, who passed away this morning. Vice President Leni Robredo mourns the passing of their very close friend, as the Vice President recalled that Soliman was present during the death of her husband, former Interior Secretary Jesse Robredo. Edwin Lacerda, presidential spokesperson during the administration of President Aquino, said that Dinky was one hardworking official. Lacerda said that Dinky ensured the poorest were not left behind through the conditional cash transfer program. He added that Dinky was the smallest member in their cabinet but had the biggest heart among them. Former House Deputy Speaker Erin Tanyada echoes this, saying Secretary Dinky may be small, but her courage and love for the country is beyond her size. Aquino's former Finance Secretary, Cesar Purisima, said that Soliman's time on earth was not enough compared to the good she could have still done and wanted to do. Despite this, Purisima said that the late DSWD Secretary helped and gave hope to millions of people. He added that Dinky left a legacy of caring and was just simply an amazing person. Let's now take a quick look at today's other top stories. Authorities say the explosion in Maguindanao that killed 8 people may have been caused by terrorist groups, politically motivated or driven by hate. But the military clarifies that no group has claimed responsibility for the attack yet. Meanwhile, in sports, Carlo Biado has won the US Open Pool Championship, becoming the first Filipino to win the tournament since Efren Bata Reyes in 1994. He beat Singapore's Aloysius Yap at 13-8. And after making history, pole vaulter EJ Obiena gets funding support from the Philippine Sports Commission for his upcoming games. And those are the top stories of the hour. Join us later again at 2:15 as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.